Hello everyone, welcome back on our channel, and my name is Giselle for those who don't know me. According to specialists, the average age of toilet training falls somewhere around 27 months. I frankly thought that my son's toilet training would take just few days or few weeks, and it would be as easy as mailing a letter to the post office. Well, it wasn't the case. My son was actually toilet trained when he was 6 years old. You're probably wondering why it took so long. The timeline, varies between children, and those with autism spectrum disorder, ASD, tend to not reach all the developmental milestones at the appropriate times, and that was the case of my son. Now, with no further ado, we have one of my favorite guests on the set today, and it's Victor.
Thank you very much.
Welcome back. So Victor, tell us, or tell a parent, how will we know when our child will be ready to be toilet trained?
So one thing that we will look out for is one, when the child is able to show that they are aware when they are attending to the call.
Okay.
Yeah. Second thing is start checking if they are able to remain dry for at least 2 hours without any mess. That means they have already attained the ability to hold onto either their bowel or their urine.
Okay.
So those are two things. And the third thing that we should be able to also pick out is when they show the interest to either sit on the toilet or on potty without any distress.
Thank you. So now the second question, toilet training a child with autism spectrum disorder or ASD usually takes longer than typical children. Can you tell us why?
Delay in communication is one reason that makes the children on the spectrum take longer, because they are depending on that language development for them to be able to express themselves what they need. They need that receptive language for them to understand what, attending to long call, before people, what it means. The second reason has to do with now their delay in social interaction. The reason why the child will go and hide somewhere and do peeing or they attend to long call is because they understand social what that means. But without understanding that social implication, then they will not have a need, that's why they will go naked and they don't worry. That's why they insist on themselves and they don't worry, because socially they don't know what that means. Okay. And now finally, it's now their delay in their physical abilities and the sensory issues. Some are resisting that toilet seat because it causes certain anxiety. So that anxiety will even make the urge itself to disappear. Immediately they think about that toilet, the urge goes. So they can keep that, if it's bowel for a long time. But if the child now is helped to develop some kind of expression, either visually or by gesture, if they are non-verbal, or just a few words to indicate, then you realize they become more friendly and more willing to participate. Yeah. So if the environment is structured in a way that it supports social interaction, it supports communication, and helps the child deal with their sensory issues, then we start having success toileting process.
Okay.
Yeah.
Thank you. So Victor, what are some of the key points to consider when you toilet train a child?
Yeah, so one that is the most basic is the child's age. So with the child on the spectrum, we still look at the age. But now this age, we will look at it in terms of how much have they achieved. If the child is still struggling with sensory issues, they're still struggling with communication, starting to embark on toilet training will cause a lot of frustration. Okay. And it may even make them also detest the activity. And the second thing is now the child's habit around the toilet training itself. How are they behaving with their long call or short call? Yeah. If already they are doing it and they are showing you they are aware, they are distressed about doing it on themselves, then that habit shows you they are ready. To be shaped. Okay. Yeah. The third thing is then also we look at now the communication abilities. It's very, very important. You have to figure out which type of communication goes well with your child, or how is the child trying to attempt to communicate to you. If they are non-verbal and they are, already they are using points, they pull you, then you have to read that communication and be able to develop on that. If they are verbal and maybe they have 1 or 2 words, it will be very necessary to start developing a word, 1 or 2, 3 words around the toileting. Something like potty, poo-poo. Develop a word there, because that word is what they will use to communicate. The moment they will just say it, poo-poo, then you will act on that and put them on a toileting seat. So within time, they start learning and associate that word with that action. It becomes very, very easy. Yeah. So another key thing to consider is what we call the child sensory profile. It's very important. And how do you know the sensory profile? Let you and your therapist, do mark out to know what sensory issues that your child has. So come up with what sensory needs that your child shows. And those one will help you to know how well do you go around toileting. Let me just explain a few sensory needs that are centered around toileting. Yeah. One, when you talk about vestibular sense, that is a sense of balance.
Okay.
For you to be able to assume a certain position, you must have a good balance. But you realize that these children, sometimes their vestibular sense is out of sync. So sometimes that's why they, if they want to assume a position, their brain tells them they are going to fall. So they resist it. They don't want to do it. That's why some will not even jump, because they are afraid of that. Then also there is another sense which is called proprioception. It's a sense of position. Like the way we are seated, if you close your eyes, you still know that you're seated. To them, some, they may not know even, am I sitting or am I standing? So if that is a problem, then you can imagine going to sit on a toilet seat. They don't know even which position should I be. So what do? They detest, they pull away, they cry, because they are trying to avoid that proprioceptive. And now the last sense that is also linked to that is the tactile.
Yes.
The toilet seat that you think is okay, to them it may be very cold, that they don't want
to see.
You get? That's why you are taking them towards the potty and they want to run away because of what is happening there. So if you do a sensory profile and maybe their problem is the tactile one, then you may want to do some accommodations.
Then you work on it.
Yeah, you work on it. Yeah, and the last one that we can talk about now in this video is now the physical readiness. Physical readiness has to do with their fine motor. Can I manipulate my pants? Can I be able to pull down? Can I be able to pull up? Can I be able to squat there for that time needed? You get? After there, can I be able to hold something and why? Always try to develop capacity in all these areas. Try to develop capacity in communication. Try to develop capacity in physical abilities. And then, once all these things come together, you realize your child achieves a certain level to be able to be toilet trained. How do we do that then? Improve our communication. Let's have visual cues, like a picture showing him or her, on a potty. That's already preparing him that this thing is done. And also sometimes talking about it with them. Whenever you are going to change them, talk about it in the language that they understand. So in their mind, they start keeping that. So when time comes, we may have high success. Yeah.
What are some of the setbacks for toilet training?
One, it's our over expectation. We expect he will pick it up and he will be able to do, and even some parents will say, why should he pick up at this age? He should be doing. Not knowing he's just a very different child. His mind of an autistic child, is not in sync with our environment.
Yes.
Yeah, they perceive environment very different. So one thing is, when you think you're ready to start this, do not over-expect outcomes to become very fast, because it will frustrate you, it will push success away. Yeah, that's one thing. The second thing that is a setback is us not having the clear information of how is our child functioning. Yeah. Then from there, because we don't have a clear, picture of who he is in terms of his ability to do things, we now come up with goals that are not achievable. So we expect that toileting will just happen as a full thing instead of breaking it down. What do we mean when we say breaking it down? Start with just him pulling down the pants. That is what should be your goal. So you'll do that consistently, frequently, with patience. And after 1 week, 1 month even, he's pulling down. Then you go to the next. This time it's not just pulling down, it's pulling down and sitting. So you see how we break down until now he's able to do the entire. So another setback has to do with bringing everyone on board. So make sure that you bring everybody on board and we know which goal are we working on so that it is consistent and it is persistent. Yeah. And the last setback that I can talk about here is starting when the child is not ready.
Yes.
Yeah.
Yeah.
Once you start when he's not ready, remember, they always try to avoid anything that causes anxiety.
Yes. Sure.
So when they are not ready and you start it, you're already telling them, run away from this. Get help if possible with your therapist to ascertain that this level he's ready. Then let's start when it's ready. Before that, success will be very far.
As usual, Victor, you have given us insightful information. Thank you so much.
Thank you.
As parents, we usually have a big celebration whenever our child meets a milestone. What other children may acquire in few months may take years and really hard work for our children on the spectrum. Patience is powerful. It is connected to faith, hope, and love. It allows us to wait with perseverance for the manifestations of God's promises in our lives, in our children, and in the different areas in which we expect God. Let me encourage you with this verse. This is what it says: rejoicing in hope, patient in tribulations, continuing steadfastly in prayer. And it's in the book of Romans chapter 12, verse 12. So we're going to have a practical video on all the things Victor took us through. If you don't want to miss it, subscribe to our YouTube channel, hit the notification bell, share this video, and until we meet again, don't forget, when we touch heaven, our lives will surely change.